Hello, YouTubers. This is Tyrone, and I am currently at my gastroenterology appointment. And it just feels good to be able to have a regular, normal follow up with no problems. Um, they wanted to make sure that I was still able to eat and swallow and not have the indigestion and acid reflux. So that's what I'm here for, getting checked. But yeah, so everything's looking pretty good. And my doctor's getting ready to come in a few seconds here, probably. It's raining today.
Mr. Logan, how you doing, my friend?
Hey, how are you?
Good. How are you feeling?
I'm doing pretty good.
Okay, where are you at in your cycle, dude?
I am on, let's see, cycle 3, day 6 will be tomorrow.
Okay.
I just finished the 5 days straight cycle last week.
Okay.
Not last week, excuse me. The week before that.
Okay.
And unfortunately, this past week they just left out dealing with a kidney infection. My home health nurse came in and took my temperature, and it was 100.3.
Ah.
Yeah, so she had to follow regular procedure, and they sent me to the ER.
So you had to get COVID tested.
I got COVID. That was
and
negative.
They found a urinary tract infection. Did they
Right.
treat you with antibiotics?
Yes. That's what the Cipro
Okay.
antibiotic that's in there.
Ah.
And I'm about finished that. Got a couple more pills.
So you know where all this is coming from. I mean, all of the chemotherapy makes you terribly immunosuppressed.
Right.
Even though we don't even see hardly urinary tract infections in males,
Mm-hmm.
when you're this immunosuppressed, it can happen. And I suspect that that's probably the reason.
Yeah, it's got to be.
Now, they're not following up with, are they following up with urology or...
No, they didn't mention anything because they know it's induced probably by the chemo, so...
Exactly.
Okay.
So then now you're with me as far as the other. How often are you taking the Carafate now?
Really, I would probably say about once a week with the...
That's fine. I don't think you need to take it.
Yeah.
So I think we can stop
Dismiss
the Carafate. The other thing is, what about the Protonics?
The Protonics, I've been taking regularly.
Now you're taking it in the morning and in the evening, or just in the morning?
Both.
Are you getting breakthrough? Are you getting burning in your chest or bitter taste in the back of your throat?
Every once in a while.
Okay.
Every once in a while, but I mean, really, I eat whatever I want, and
so this is what I'm going to say. I think we can decrease the Protonics to once a day.
Okay.
And see if your symptoms come back.
Okay.
In the meantime, just stop the Carafate.
Gotcha.
I don't think you need the Carafate at all.
Yeah.
If you need to take a like if you're miserable and you need to take a Protonics at night, just take it. But in general, just take it once a day. Take it in the morning. Take it on an empty stomach.
Okay.
You don't need to be taking all that Protonics if you don't need it.
Gotcha.
If you need it, you may go ahead and take an extra dose at night. I wouldn't make that a regular thing. And if you are going to make it a regular thing, send me a MyChart note and say,
Gotcha.
Hey, Kelly, I'm back on twice a day and I'm miserable.
Okay.
And we'll go from there, okay?
Gotcha.
So...
because everything is pretty much running regular,
So no real heartburn.
No.
But you're eating pretty good.
Yeah, I eat whatever.
Oh, okay. So are you eating healthy? Are you eating junk food? What are you doing?
A little of both.
Okay. No fever, no chills?
To be honest with you, no, not except for this past week when I had the fever. But other than that, no. No nausea. Yeah.
No nausea. No vomiting. Now, let me just set you up for this. And I only say this because I don't want to scare you, but you're a smart guy and you're home and you know what's going on.
Right.
When you take Cipro for a urinary tract infection and you're immunosuppressed, sometimes you can get the normal colon flora, the normal bugs that live in your colon, get killed by the Cipro.
Okay.
So sometimes you can get diarrhea afterwards or during.
Gotcha.
If you start getting diarrhea, dude, I need to know.
Okay.
Now, do you take a probiotic?
No, I don't.
So when you're on,
and I don't eat like yogurts or
no,
anything.
you can't get enough with that anyway. Don't even worry about that. What I'm thinking is, if you only have a couple pills left, right?
Mm-hmm.
Okay. Next time you have to take an antibiotic for any particular reason, take a probiotic too. It's culturelle aligned, something like that.
Mm-hmm.
It gives you back the normal bacteria while you're taking an antibiotic.
Gotcha.
But for right now, I don't really care. All I want you to know is if you start getting diarrhea, you can get it a day, 2 days, 3 days, 5 weeks, whatever. You need to be on the horn with me, because we're going to have to do a swab and make sure you don't have C. diff.
Okay.
Clostridium difficile lives in your guts normally, but if we kill all the good stuff, then it can wreak havoc because it plays all by itself and then it starts playing bad.
Gotcha.
So you just need to know that in the back of your mind, that it could be a side effect of having taken some antibiotics.
Okay.
Like right now, it sounds like you're fine.
Yeah.
How often are you pooping now?
Regularly. I mean, probably once. I probably say once every other day.
Okay.
Yeah.
Any diarrhea?
No.
No constipation?
A little bit of constipation.
Okay. What are you using for that? Anything?
I did have. I have a prescription, but most of the time I just eat some oatmeal or something fibery, cereal.
So you have a prescription for Colace?
I think that's what it is. Yeah.
Are you taking any pain medicine?
No further than Tylenol.
Okay.
And that's as needed.
Yep.
And I haven't really taken that except for this past week with the I use it more for the fever reduction.
That's fine. Has a script for Colace, denies pain medications. What's the deal with you and your COVID vaccination?
It was negative.
No, vaccination.
The vaccination.
You should be a high risk group, and you're not.
I'm
okay.
really not interested.
Okay, that's fine. That's fine. You just need to stay safe, okay?
Right.
Make sure you're washing your hands. Make sure you're wearing don't go into, massively
crowded areas.
Yeah.
Mm-hmm.
So just stay, sort of stay away from that.
And actually, surprisingly, my white blood cells were actually higher than they were regular, normal, but they've been running like 5 or 6. And now they're at a 9.
Okay.
And that was, let's see, I saw the doctor Monday. That's right. It was Monday. It was Monday.
Now that also could have been from your urinary tract infection. Who knows? Because sometimes when you have a UTI, your white count can go up.
Oh, really?
Yeah, and then it can kind of drop back down. So no worries.
That's weird.
Yeah, no worries. I think that's fine. I think as long as it's not in the gutter, in the nothingness, that and you're a young, healthy guy, right? So that's all good. Okay. No blood in the stool?
No.
Okay. So when you say tend towards constipation, are your stools usually like a soft log and then they can get a little harder? Or where do you usually live on the continuum of stools?
Like between a 4 and 5.
Between a 4. Okay, that's fine.
Yeah.
I think if you find it's getting hard, and when I say hard, I mean like up here, 2 and 3, pull out that Colace script or call me up and I'll give you one.
Okay.
All it does is soften things up, but fiber does the same thing. So if you can take some oatmeal or some Metamucil or something that actually helps getting you back down here, the goal is always to be here. I don't even mind if you're a little bit softer. I don't want you down here because that's a problem, and I certainly don't want you up here. Okay, right. So I really want you kind of staying around this area.
Okay.
I don't want you to have to strain too much to have a bowel movement. Okay.
And plus, even with this nephrostomy bag, like the more air I have to, because it's right there by my lung,
Gotcha.
Right,
so did you have the nephrostomy when I saw you last? Yes, you did. Because you were having home health come out and change the dressing. Okay. And it's working well?
Yeah, well.
Except for it's a not. The problem is
it needs to come out now. It's.
So when are you scheduled to go see urology? I mean, nephrology.
He's trying to get it scheduled with VIR over in Greenville now. Really.
Who? Your oncologist?
Mm-hmm. Yeah, he told me. He actually asked me, did I want to leave it in there or get it taken out, because I had the option because the mass has shrunk.
Yes.
So it's not pressing up against my kidney anymore. So I'm functioning the way I'm supposed to be functioning.
Yes.
So
and your answer
no
was, get it out.
Right.
I'll be honest with you, that
it
is a good answer, because anything that's not part of you is a place where you can get infection. Exactly. So if you could get it out, great. And
I had, I'm thinking, I'm not sure if you can see on your, in the my chart visits or whatever. I think it's February 12th or something.
Yeah.
I don't know if this is under visitation. I mean, under appointments.
Yeah. Catheter exchange nephrostomy.
What's that?
So this is February 12th.
Yeah, okay. It is for
10:30 to 11:30. 91 days followed requesting for nephrostomy due to possible tube removal versus exchange.
Huh. Okay.
Hopefully they'll take it out.
Right.
Is this his shot? Yeah. Okay. All right. Good.
Yep.
All right. What else you got going on here? Let's just see. Deborah O'Neill. That's
that's home.
Yeah. You're getting labs done on the 26th at the cancer center. You're going to see Vijay Chaudhry on the 26th tomorrow. Home health. There's your rapid COVID test, and that's because of that procedure.
Exactly.
Okay. Cool. Okay, so that's what you got going on.
So listen. Hopefully on the 12th they go ahead and take that out instead of.
So this is what I'm going to do. I'm going to tell you that you're going to come off the Carafate. You're going to go to once a day on the acid pill.
Okay.
If you have breakthrough symptoms, you're going to let me know.
Okay.
If you start having loose stool, you're going to let me know.
Gotcha.
If you start getting really hard constipated, you're going to increase your fiber. And or you're gonna take some Colace, and if you need it, I'll send it in. Not a problem.
Okay.
There's no reason at this point in time for you to have to come back and see me over and over and over again.
Okay.
Let's make an appointment for like 6 months from now.
Okay.
So that I can just maybe get you off completely that
Gotcha.
Acid pill. How many total rounds did they say you were gonna have to do?
It's 4 cycles for the chemo, so I've got like 1 more month of February, pretty much.
So January, February, March, April, May. So yeah, let's try to meet up with each other maybe around May. Okay. And if you're doing great, you never had to take medicine before you had all this happen. Yeah, so I want you off. If I can get you off, I'll get you off, okay?
I hate taking medicine.
Yeah, I know. But you know what? Sometimes you gotta just take it to
get by.
to ward off the stuff that the chemo's doing to you.
Right.
You know what I mean?
Right.
So we'll do that. And like I said, my goal for you, you're way too young to be on a bunch of medicine. So we'll try to get you off in around 5 or 6 months. I'll probably do around 5 months, okay?
Okay.
How is your appetite? How's your weight?
My weight, I've gained 10 pounds.
Oh, thank God.
Yeah.
Good. You look better.
Yeah. Stuff that normally happens to chemo patients, I'm very grateful and thankful I haven't experienced so much.
Good.
I mean, I had a little rough go there, in the beginning.
Yeah.
But
well,
here afterwards.
Let me tell you, you're a champ, and in my book, you're just one of those top stars that has kind of rolled with the punches with, having something happen and responding in a way that, hopefully really is the way you need to respond. I think when you body work, you never remember a lot of people think that they do. And come on up here. So and I think you got to be in at full steam with both your mind and your body.
So you succumb to whatever you're going.
That's right. Well, it sounds like you've got an awesome family support too. Big breath. And out.
Got a little.
You're good.
I'm sorry.
Big breath. And out. Again. And out. Again. and out. Again, and out. Okay. Just relax and listen to your ticker. Perfect. Any pain? Any pain when I tap this kidney? How about this kidney?
Nope.
Swelling in your legs?
Nope.
Chest pain, shortness of breath?
Nope. Just got that little cough that you just heard. And I don't know. I'm not really sure where that was coming from. But
where did that start? When did that start?
I'd probably say like last Sunday.
Is it productive or no? You're not coughing anything out?
I coughed up a little. It was clear, and it was lined with a little blood.
Just one time?
Just as a matter of fact, it was this morning when I got up, and that was the only thing that I've actually coughed up. I have had like a runny nose,
and you haven't been around anybody with COVID.
And I noticed, like when I do blow my nose, it's bloody a lot of times. And I'm thinking.
Yeah, maybe the dry air and the.
And then I know some of that might be my platelets might be low.
Yeah, what were your last platelets?
I think he said everything was good. My liver numbers were a little elevated, which they normally are.
What happened with that one? What's your blood count there?
What's that?
Oh, it says future. This is to be done. Okay.
Oh.
So he must have gotten them and then put them in again. Okay, so yeah, I mean your blood counts were down a little bit, 10.4 and 30, and your platelet count was 71. So yeah, that's low. That's lower than normal.
Which would cause bleeding.
Yes, it will.
So.
All right.
So that's the only thing I could think of.
Yes, and let me look at your other stuff just since you said that, and you said your liver numbers were a little elevated. So yeah, your Appt, but your Appt I think has always been elevated since you've been on.
Just slightly, yeah.
Let me hold on. Filters. Let's look at. Here, you can come on down. We'll look at them together here. So here's your lab flow sheet. So. This is you over the past, since, well, I can even go back here. Yeah, okay, so it's all pretty much 2020, but anyway, so here's your Appt. So your Appt has been, actually, it's come down pretty significantly. Look at that. Now, your amylase and lipase.
So what is the
I think that, well, it's right here. 40 to 150.
Okay.
So 179 is really nominal to nothing, and you were 453. So that's a big difference. Yeah. And then your liver numbers. These are your liver enzymes. Kind of has always been hovering a little bit, and that probably goes along with the chemotherapy. But look, those were down to normal. Anything in yellow is abnormal, by the way.
Gotcha.
So your albumin's a little low. But your weight is up, so that's good. But you want to make sure you keep your albumin up. That's protein. You're drinking. Okay. You're eating.
I mean, I do. I drink like protein shakes.
Good. And, how many a day?
Usually, probably one.
Okay.
Yeah, and
you're not that bad. I mean, 3.5. You're 3.4. You still want to keep that normal though, because you've got to have good nutrition in order to get good healing. So that's important.
Especially at keto.
Correct.
Protein.
That's correct. Yes. So you gotta watch that. But he put you in for new labs. So I'm assuming you're supposed to go get labs. Oh, perfect. Perfect. Okay. So I may even put a tickler on myself to make sure that I look at them too. Okay.
Okay.
So I think. You said you're not getting a bunch of heartburn. You really haven't had more swallowing issues, right? You're swallowing just fine. No belly pain.
None.
Appetite is good. Weight is up 10 pounds. So at this point, I think we won't stop this, but instead of twice a day, we'll go to once a day.
Okay.
We will stop the Carafate. right?
Mm-hmm.
And you're going to let me know if you have any breakthrough constipation or changes in your bowel habits.
Okay.
Okay. And if any of that happens, I need to know. Otherwise, I think you're good. And then I'm just gonna. Now you've never been scoped from above. In other words, they diagnosed you with this CAT scan that they did.
Mm-hmm.
But I don't think with everything that resolved after the medicine, you need to be scoped right now.
Okay.
Okay. So I'm gonna say that we're good to go. And like I said, I'm gonna see you here in just a few months, and we'll decide, is he 100% better? If you are 100% better and you're done with your chemotherapy, then I think we're going to be like good. Now, is there any talk about what is the deal after you finish your chemo? Are they talking about doing
they haven't mentioned
surgery?
They haven't mentioned radiation. They kind of briefly talked about surgery, but
what'd they say?
Just to. But the main thing was they wanted to do the chemo to see how much they can get it shrunk.
That's right.
And hopefully they won't have to do the surgery at all.
Okay.
That's the goal.
Yep.
And
you know what? Let's just look for kicks and giggles since we can. We can sneak up and look.
I forgot exactly how far the mass has shrunk. I try to keep all this stuff in my head.
Yeah, it's hard to do that.
I think it's from an 8 centimeter down to like a 3.
Wow, that's fabulous. All right. Here I can.
I might be exaggerating. I'm holding it.
Well, no, I'll look on. I can look. We can look together here. So this was his last note. Let's look down at the plan. Here it is. Here it is. Okay, so your status post, they took the right testicle.
Yes.
With a large tumor specimen.
Okay.
Negative surgical margins, that's fabulous. Did not receive any adjuvant chemo, but then you went back and started it again.
Mm-hmm.
Okay.
So you want to really start probably around the 27th of October is when
started?
Yeah, because the one before in the earlier part of 2020 was the testicle and the orchiectomy. Then the one in my back, the mass in my back is starting from October 27th on down until current.
Okay. Yeah, so here it is. It says I will refer him to VIR for nephrostogram and potential removal of the nephrostomy tube, given no significant output as well as at risk for infection. So that's what he said.
Gotcha.
Okay.
Now I just need to follow through.
That's right. So listen, you need to get healthy or as healthy as you can, okay? If you get any GI problems, Mr. Logan, I need you to let me know, like sooner rather than later. You've got my chart. Do you know how to use my chart?
Basically.
So you look for
I've
me.
Never really...
You look for me, Kelly Brilliant. You send me a message. If you can't get that, you grab one of my cards before you leave, and you make sure you give the office a call and just leave me a message.
Okay.
I mean, this is not stuff that we want to get behind. I'd rather get ahead of. I'd rather not have it happen at all. But if it's gonna, I want it to happen. Yeah, I want you to call me and tell me what's going on sooner rather than later. Okay?
All right.
All right, my friend. So let's say 5 months, and like I said, with a goal in 5 months, that the only medication that's on for me is the Protonics, and you're only taking it once a day. If something happens, you let me know, and if it doesn't happen when I see you back, we'll decide where you're at, and then we'll decide whether or not what we want to do. The ultimate goal would be, let's stop it. Okay? Yeah, we'll do May, and that way it'll let you get all through this other stuff.
Okay.
All right, my friend. Now, where are you going to get your labs done?
They know right there at the cancer center.
So you have to drive back over there tomorrow? Or
tomorrow.
you're over there tomorrow, right?
Yeah, well, I live here in Washington, but
you're going to drive over there?
Right, because I've got chemo tomorrow.
Okay,
So
then that'll work. Okay.
They always do.
Before they do the chemo?
Exactly.
Okay, that makes sense, Mr. Lee. Come on with me. It's a pleasure to have met you. I think you're pretty awesome. So if you need anything, all you got to do is let me know. And Miss Renee will get you checked out and get you on your way. Okay, thank you. Good to see you again. Listen, stay healthy. All right.
Hello, Miss Renee. Tyrone Logan.
She said come back 4 months. That is going to be Tuesday, May the 25th. Would you like morning or afternoon?
We can do morning.
We've got 10 o'clock, 9 o'clock, or 10 o'clock, and 11
I'll
o'clock.
take the 9.
Okay.
That'll be fine.
Let me get it printed out for you.
You said Tuesday,
May the 25th.
May the 25th.
All right, I will check it out. I'll call you right back, okay?
Alrighty.